Good morning, everyone. We are going to do mental health today. A client is admitted with acute manic episode, is becoming angry and disrupting in the group therapy session. When the nurse firmly sets limits and stated that the behavior is inappropriate, the client becomes verbally abusive and hostile and belligerent. Which of the following is the best nursing action? Good. Number one, assist other clients in the group therapy session to safely leave the room. Number two, call for assistance from staff and escort the client to his room. Number three, say calmly to the client, your behavior is not appropriate. Number four, let the client know that he is not allowed to attend group therapy anymore. Four options. What is the best nursing action? So in this question, again, we are going to look for clues. First, we are going to understand the question, and then we are going to look for clues which can help us to eliminate what is not the best answer, right? So clues here. Let me get those little words right here to help you understand that. Number one, the client is admitted with acute manic episode. So that's a big clue right there. The patient is having acute symptoms, acute mania. So they need help. They have probably no realization about what is going on. Probably they are not having judgment. They are not having a reality perception right now because there is acute manic episode, because that's what the signs and symptoms shows up, right? So that's one. Second thing, the client is becoming angry, and yes, the patient with acute manic episodes will get easily angry, and they don't like criticism. They don't like power struggles. They are they can be very labile emotional wise. So they are getting very angry and is disrupting the group therapy session. Disrupting the group therapy session. So they are in the group therapy session, and this patient is getting angry and disturbing everybody. Right? The nurse firmly sets limits and stated that the behavior is inappropriate. And exactly that's what we are trying to do, or we are supposed to do when a manic patient is manipulating or disrupting, kind of behavior. We are supposed to set limit, be consistent with the limits, let them know the consequences, and let them be safe, and others also be safe, because safety is always one of the priority, right? So the nurse already acted like that. She set firm sets, limits. It's already been set, and also stated that the behavior is inappropriate. And then what happened? How did the patient reacted to it? The client became verbally abusive, hostile, and belligerent. Okay, that means they are kind of attack mode, right? They are angry. They are like going to hurt someone kind of mode. And belligerent means you are ready to harm someone. You are like attack mode. Okay, so it's really, really escalated. The patient's situation escalated. Even though the nurse did what was right to do, like try to set limits and say that it's inappropriate, it didn't work. Definitely it didn't work, because the things escalated. Right? Now what do we do? That's the question. So a couple of things which comes to your mind should be, one, about safety. And second, how can we take care of this client and the other people? Right? Now focus on the client. The question is asking about what do you do for the client? We cannot ignore the client, right? So let's look at the options and see if we can eliminate something. So we are going to start with number 4. Let the client know that he is not allowed to attend group therapy anymore. Now, there are two ways to think about it. One, is it okay to talk about consequences of behavior? And the answer is yes. That's one way that we tell the patient when they are manipulating or they are disrupting. We are telling the patient that this is not appropriate, and this kind of consequence, these are the consequences which can happen. But the problem here, this is not the right consequences. Now remember about client's right. Okay, every client has the right to get the standard treatment. Whether they are competent or not, if a treatment is part of their disease process, that's something which they should get, they have the right to have that. We cannot deny somebody a therapy session because of the way they acted. And with this patient is acute manic episode, we don't want to have any power struggles. We don't want to say, you do like that, you are not getting this. You are not the one who decides here. I am the nurse in charge. I will decide. You act according to what I say. If we say something like that, that's a lot of power struggle. These patients with mania, especially acute mania, does not love criticism. No way. They will not have any kind of tolerance towards those kind of words or our behavior. Right? And the one which is escalated is going to become worse if we say something like that. Right? Because of these reasons, these rationale, 4 is not our answer. Right? So we are going to take off 4. Now, let's talk about 3. Say calmly to the client, your behavior is not appropriate. If this was something initially to be done, this would have been a perfect answer. When the patient is initially becoming angry, disrupting, and if I as a nurse is going to tell the patient, okay, this behavior is not appropriate, this is not acceptable here, that is great. That is simple, focused, setting limit. Then why we are not so happy about that option here? Because it's already been tried and it's not working. See that in the question that the nurse firmly set limit, it's done, and stated that the behavior is inappropriate. It has been already tried, but still the patient is angry. It's getting worse. So again and again saying the same thing without doing proper clinical judgment is not the right way to answer that. Okay, here, this is the time the nurses will use recognizing cues, which is a clinical judgment part. You see the clues, you see the cues, you acted on it, you made a decision and acted on it, and you re-evaluated it. And when you re-evaluated, you saw that it's not working. So if something is not working, we go to the next step. We assess again what is the next thing we can do. That is the next step, not staying where we did at first. All right. Because of that, 3 is not our answer. Even though this is a good thing to do, we tried, we failed. Next answer. Okay. So next one, I'm going to talk about 1. Assist other clients in group therapy session to safely leave the room. It's a very good thing to do. Again, it's a very good thing to do. But the problem here, we are not doing anything for the patient. We are not focusing on the patient. Yes, we are assisting others to leave the room. So what is going to happen if a mania patient who love to be the center of attraction, because that's part of their clinical manifestation, right? They want to be recognized, they want to be noticed, they will try to do everything so people kind of see them. So if somebody is in that state and just acting out, there's a big thing going on, disrupting everybody, and we come by and say, everybody else, please leave, because who is getting all the attention now? Focus. The patient with the mania episode. And what's going to happen? It's going to encourage them to do more and more. That's one part. Second, we cannot leave the patient and think about other clients at this moment because our focus is on the patient, right? The patient is having trouble. So 1 is not the best nursing action. We might do it later, but not the best at this moment, right? And because of that, I'm going to take that off. And so the answer is going to be call for assistance from staff and escort the client to his room. Now, if we do that, 1, we are making sure the client is okay, and when the client is leaving, the other people will be okay, and they are probably going to continue with their that group therapy session, which is fantastic. They get the treatment. Now this patient will need more interventions. I mean, I'm not sure what we are going to do, but the first thing we need to do is eliminate that threat, because the patient already escalated and is becoming harmful and safety issue for everybody. Okay, escort the client to the room. Now, do we want to put restraints? Probably not, okay, because restraints are always our last resort. All right, so 2 is the best answer in this question. And that's how you eliminate and you put the dots together and do those critical thinking and clinical judgment, because that's how you can answer the correct answer. All right. Okay.